All right, so let's get started. And as usual, the disclaimer applies that this is for informational and educational purposes only. It's not a substitute for medical advice from your primary care provider. We're definitely not diagnosing or treating anything on this call. So if you're going to implement things you learned from this call, speak first with your primary care provider to make sure it's relevant and applicable to your case. If you're seeing this recording in the future, this information is always changing. And again, today we'll be discussing COVID topics. So it's likely that some of this will be different at the time that you watch this. So always make sure that you're getting the most up-to-date information. And I can't promise that this will be up-to-date at the time that you watch it. And I don't make any warranties or express or implied representations about the accuracy or completeness of this material. This is what I'm teaching to the best of my ability to synthesize the material and knowledge. So what I want to talk about today is a study that came out this week titled Integrative Considerations During the COVID-19 Pandemic. And it's written by a bunch of authors that are in the integrative space. And the super important thing in my mind about this is that primarily other people are thinking about holistic attempts to address COVID. They're not just sitting on their hands and saying, oh, we're hopeless until the miracle vaccine comes out or the miracle drug comes out. If you know anything about recent history, there is no miracle drug, there is no miracle vaccine, especially if they're going to bring it out to the public before proper safety and efficacy testing, which requires years to do, which will not be done. And based on vaccine history of vaccines currently on the market, it's not done with those either. So don't hold your breath on that. There are integrative considerations and natural methods we can apply today to drive optimal prevention of the infection or drive optimal recovery from the infection. And these authors are diving into that as well. So this won't be news to you in terms of, if you've been with me for any amount of time, the functional mindset of addressing the whole person and the lifestyle, but it's nice to see it published in the scientific journal. So especially specific to COVID, which hasn't been done yet. So these authors first start by saying none of these integrative measures have been validated in human trials as effective specifically for COVID. So COVID is new. The research hasn't been done taking COVID infected patients and applying these strategies and studying it to see if it was effective or not. But we can't wait for that if it's truly a pandemic, right? We need to do what we can right now to minimize the damage. Now, the narrative is overblown and overhyped. It's not truly a pandemic. If you go by the definition of pandemic from 2009 and previous to that, but they changed the World Health Organization and the CDC changed the definition of pandemic in 2009 during the swine flu pandemic, so that basically, going by their new definition, anything could be called a pandemic. And that's helpful to them because if they want to create fear and move the population a certain way, you just create a pandemic through the media and you're off to the races. And that's what we're seeing. Yes, people are dying. Yes, people are infected. Yes, it is having a toll, but it's not. If you look at the predictions, they were originally predicting 2 million deaths, 200,000 deaths. Now it's down to 80,000. Oh, now we're predicting 20,000. Okay, so obviously overhyped down to more realistic. And the people who are dying, most of them are 60 plus, so it's pre-existing conditions. So again, if you have an overall functional mindset where you're promoting health from a lifestyle, holistic, overall health perspective, whatever your favorite word is, integrative. If you're focusing on that, then your probability of having a severe infection is very low if you don't have pre-existing conditions and you're not 60 plus. Okay, now let's dive in. So the researchers start with talking about what the mechanism of action is of COVID. So basically, COVID is the disease. SARS-CoV-2 is the infection. It's like HIV is the virus, AIDS is the disease, SARS-CoV-2 is the virus, COVID-19 is the infection. Okay, so the way that SARS-CoV-2 drives COVID-19, the disease, as we call it, is through activation of the NLRP3 inflammasome. What the heck is that? That is basically, it's something that's built inside your cells when, as an inflammatory response to, say, an infection or an imbalance in macronutrients like cholesterol or sugar, etc. So we all have NLRP3 inflammasomes active in us. It's just, are you having overactivation of it? Okay, so the SARS-CoV-2 virus drives overactivation of the NLRP3 inflammasome, resulting in COVID-19. That is the hypothesis by these authors. Now, when that occurs, the inflammasome activation drives up cytokines like interleukin-6, interleukin-1 beta, TNF-alpha, and these things drive a massive inflammatory response. And when it's happening in the lung epithelium, you may damage the lung barrier. And if the virus proceeds and you don't get on top of it, damaging that lung barrier obviously promotes inflammation in the lung, maybe infection in the lung, and now you have a pneumonia or acute respiratory distress syndrome. You're intubated on a ventilator, possibly perish. So that's kind of the spectrum. But we want to remember that statistics say anyone from 50 or any amount from 50 to 81% of individuals will have the infection and have no symptoms at all and recover fine from it. So the likelihood is that the majority of people have had it already and don't even know. The ones that are being reported in the news are dying because they're elderly and have pre-existing conditions. If you see anything in the news that's saying someone healthy died from it or a young person died from it, you really need to dig and get the facts of that case before you just believe it. For example, I saw a report today that a newborn in Louisiana died of COVID. When you dig, that newborn was born at 22 weeks, and that is not a healthy newborn. You find out the sex, around 18 to 20 weeks. So that newborn was born wildly premature. The newborns can't breathe without a respirator until 34 weeks. So again, that wasn't a healthy newborn. That was a complicated case. So you want to dig. But anyway, back to the study. So these authors are diving into lifestyle factors that can reduce your risk of infection, and a huge one is sleep. Sleep is very important because sleep is when we are our best killers. When you're about to fall asleep, melatonin increases. Melatonin is driving what's called a T helper type 1 response to the immune system overnight, and that's the response that drives antiviral defenses and kills infected cells. So if you're not sleeping, you're not getting that optimal response, and you're more prone for infection. Also, if you're not sleeping, you're more prone for inflammation, which can drive the infection. So they cite studies here showing that if you're sleeping less than 5 hours a night, you'll have an increased risk of infectious illness. And specific to COVID, sleep deprivation drives NLRP3 inflammasome activation. So you're driving the mechanism that COVID also drives. So if you're sleep deprived, you already have that inflammasome activation, and then you're exposed and infected by COVID. Now we have next level activation of that mechanism, and perhaps your case goes worse than it would have if you had just slept better. So you want optimal sleep for many, many reasons. These are just a couple. Stress. Of course, stress is going to, as I've discussed in many videos, you can go back on the channel and search those, but psychological stress from any reason, inhibits optimal immune function and promotes infection. So is it safe to say many people are psychologically stressed right now? whether it's from the COVID pandemic itself or from the loss of a job or lack of income or being locked down in your house. There's many stressors right now. So optimizing your mental state is going to be key in preventing infection and recovering from infection. So how do you do that? You need mindfulness practices like meditation, prayer, yoga, walking barefoot in nature, petting your dog, doing things that get you to relax. That's going to be beneficial for you and support optimal immune function and be anti-inflammatory. Zinc, as I've discussed on previous videos, is a key nutrient for immune support and for optimal outcomes in coronavirus. These authors say 15 to 30 milligrams per day. I think that's a little low. If you're in the acute phase, you can go 30 to 45 for short term. Again, work with your practitioner to discuss that. If you go too high zinc for too long and you're not also taking copper, you can throw off your zinc to copper ratio. So again, you want to know your levels and titrate dose specifically to you. Fruits and vegetables, obviously diet matters, right? So we want to be eating an anti-inflammatory diet. And in terms of specific to COVID, if COVID drives the NLRP3 inflammasome as its mechanism of damage, then we can consume foods high in flavonoids that inhibit that inflammasome activation. And fruits and vegetables are loaded with those things. And the study lists many of them. But turmeric's going to be big. Quercetin from onions is big. Tomatoes, oranges, nuts, and berries are big. So, of course, eating a healthy diet full of fruits and vegetables is going to be beneficial. Vitamin C, I just put out a vitamin C video earlier this week diving into why vitamin C is helpful for any infection, let alone coronavirus. But getting into the specifics of immunologically why is vitamin C important. So go check that out. It's called Vitamin C for Antiviral Defenses on my YouTube channel. But vitamin C inhibits the NLRP3 inflammasome activation as another way that it's important in this infection. Melatonin, we talked about, you're your best killer at night. Melatonin has another role as anti-inflammatory and antioxidant, and it inhibits NLRP3 inflammasome activation. It also specifically reduces lung injury and inflammatory cell recruitment in the viral infections. So coronavirus is upper respiratory tract. The people who are dying, many of them due to lung issues. So if melatonin decreases lung inflammation and decreases recruitment of the immune system or the inflammatory cells to the lung, that can be beneficial. Here's an interesting one. Elderberry. Elderberry is the darling to the alternative health blogosphere, right? Everyone buys their elderberries in the fall and makes their own syrup and all that to prevent infection, and it's good. Elderberry is antiviral. These authors state that there's preclinical evidence that elderberry inhibits replication of viral attachment of human coronavirus NL63. That's not the same as SARS-CoV-2 that causes COVID-19, but it is a member of the family. So that's interesting. Elderberry is antiviral, but people are worried about the cytokine storm of elderberry, which may or may not be something we really need to worry about. If we look at a separate piece of information here by Chris Masterjohn, who is a PhD, he recently put out an article where he did a research review looking at the cytokine storm and elderberry and is it dangerous. And I'll cut to the chase for you, but the link is up here if you want to see the article. And actually you could just Google, could elderberry cause the cytokine storm in COVID-19? Extremely unlikely, and you'll get the article. And it's by Chris Masterjohn. But, well, I guess the title tells you everything you need to know. But he went through all available cell studies and human studies to basically say, no, the cytokine storm from elderberry is not going to is very unlikely to happen in coronavirus. There's no human studies on that yet, but we do have human studies on the flu, and it's never caused a cytokine storm in the flu. So you're likely safe to take elderberry, but again, speak with your primary provider to get their opinion on that. If you're worried about it, you don't have to take elderberry. There's other options. You could take astragalus and get the same benefits as elderberry without the risk of cytokine storm, however small that risk is. I just want you to hear that side of the story. And then vitamin D. The authors are also waffling on vitamin D because it's been found to decrease inflammasome activation. So they're saying, oh, that's good. And vitamin D receptor activation reduces interleukin-1 beta secretion, so that's good. But then they say, oh, it's also been found to increase interleukin-1 beta levels, so that's bad. Well, if you understand the immunology, interleukin-1 beta and TNF alpha are cytokines that are pro-inflammatory, so they drive inflammation. So their thinking is, well, if the vitamin D is increasing interleukin-1 beta levels, we probably don't want that in COVID. But the vitamin D is increasing interleukin-1 beta levels to recruit the immune system, the macrophages, so they can make lysosomal enzymes, so they can help kill. So, and vitamin D inhibits the inflammasome activation. So if you're inhibiting the mechanism by which the virus caused damage, and you're helping your immune cells to be better killers, sounds like vitamin D would be useful. And then lastly, they mention other things like I've already said, astragalus, quercetin, green tea, zinc we talked about, and vitamin A. So vitamin A is great in upper respiratory tract infections. I've covered this in previous videos. So they give dosing recommendations here. Again, you want to know your vitamin A levels. It is a fat-soluble hormone, so if you overdose, you can have symptoms, but you can do short-term high dosing very effectively. Work with your primary care provider to determine what is best for you in terms of dosing of vitamin A. So to wrap it up, this article is very useful from the point that, hey, other people out there in the medical realm are thinking and looking for ways to help without waiting for the magic bullet vaccine or drug that isn't going to come. So this is good. And what they're realizing is that your whole life matters. Your sleep matters. Your diet matters. What's not in this study is your physical activity matters. Exercise is hugely beneficial in many, many ways. So you want to be exercising. Your EMF exposure matters. EMF, I've talked about in previous videos, increases viral replication. So if you're bathing yourself in Wi-Fi or in 5G or in any EMFs, you are likely making it harder for yourself to prevent the infection or beat the infection, and hurting yourself in many other ways potentially. So don't overexpose yourself when unnecessary to EMFs. Don't keep your cell phone on you, et cetera, et cetera. That's video for another day. But I hope this is useful. Sleep, decrease your stress, get that diet dialed in, make sure you're getting your exercise and your sun exposure, and work with your practitioner to determine a supplement regimen that is optimal for you to make sure that you're living a life at optimal.